Jeremy Corbyn.
Thank you, Mr Deputy Speaker. Can the Secretary of State not just for once acknowledge the stress levels of workers, postal workers, rail workers, health workers, teachers, who've had 10 years of frozen pay, 10 years of reducing living standards, going through enormous stress at work, many leaving the teaching and nursing professions as a result of it. Nobody likely votes to take strike action unless it's an act of desperation. They do it because they want to get decent pay for themselves and their loved ones and their families. Can he not, for once, face the issue of the poverty that people face, rather than trying to bring in draconian laws to prevent people taking effective action in order to remedy the injustice that they are currently facing?
Minister.
It's obviously not true, Mr Deputy Speaker, that there's been pay freeze for 10 years. It stands there and makes a claim. I just actually mentioned from the dispatch box that because the NHS was under huge pressure during COVID. Actually, nurses and workers in the NHS, 1.2 million, I think, in total, were provided an uplift last year of £1,400, I think, or £1,200 last year, £1,400 proposed this year, even though, at the time, inflation was low, even though the rest of the public sector wasn't receiving pay increases. But he talks about stress for public sector workers, and I do recognise the hard work that they put in and the hours that they put in, particularly in the NHS, which is why we've expanded by many thousand the number of nurses, for example. But what about the stress for people who can't get to work with these strikes and haven't been able to for months? What about the stress for people who might be waiting for an ambulance when we don't have nationally agreed safety levels in place? That's the stress that I'm also worried about.